Hi there, and thanks for joining us. I'm Julie Musgrave. Community regional employees recently got together to give back. A blood drive that set a plan in motion to make sure not just Fresno's taken care of, but any hospital with a high demand for blood.
The more acute the surgery, the more likely you are to utilize blood products.
Dr. Sarah Manassian is a cardiothoracic surgeon at Community Regional Medical Center. She knows firsthand how important it is to have blood on demand.
Doesn't mean we're going to use it, but we won't do the surgery unless we know we have them.
Recently, Dr. Manassian says she and others at the hospital were doing an evaluation of how much blood they utilize compared to others. And then tragedy in Las Vegas happened.
It was essentially a reset button for everybody.
They saw a hospital in dire need of blood.
Our initial response was, well, we have to provide them with any blood products, any services. This is a trauma center that's dealing with incredible tragedy, and we have to help out any way we can.
She says the conversation turned from how do we take care of ourselves to how do we take care of ourselves and more.
We have to do both. We should be able to do both, and we have to do both.
It was one of the most exciting things I've experienced in my many years of blood banking.
Community regional employees held the first blood drive with this mentality in mind back in February with much success.
When people are helping one another to make sure at Community that you can care for every single patient who walks in the door, and that at the Central California Blood Center, when those calls come, we don't have to take a breath and say, it may be hours or it may be days before we can help.
Leslie Bodis with Central California Blood Center says they are always in need of donors. Just one person can save the life of 3 others.
At the end of every donor needle is a patient, and that's a patient who has a chance at living if those blood products are there.
And I see this as a community coming together, regardless of our backgrounds, to do something that's very, very special and needed for people in Fresno and the surrounding communities.
Dr. Manassian says they now hope to keep growing these efforts by having a working list of healthy donors and expand the area. After all, this is home for community employees too.
This is an effort on the part of community, and I really wanted it to be from the healthcare providers themselves. We take care of the Fresno community in many, many ways, but I also wanted to press the point that we are not shy to donate our own blood so that we can make sure that these services are provided to our patients in a timely fashion, and some more.
To be eligible to donate blood, you must weigh 110 pounds, be 16 years of age with parents' permission, and in general good health. For more information, check out donateblood.org.